to speak before and to be part of this outstanding panel of speakers. Dear colleagues, the global drug problem is a multifaceted challenge that encompasses supply, demand, misuse, and abuse. It transcends borders, affecting communities, economies, and public health worldwide. Addressing this complex issue requires a concerted effort and collaboration among different stakeholders. Strengthening regional and international cooperation is essential to create comprehensive strategies that tackle the root causes of the drug abuse. This includes sharing best practices, enhancing law enforcement collaboration to disrupt trafficking networks, and implementing evidence-based prevention and treatment programs. Furthermore, fostering dialogue among stakeholders, including governments, civil society, and health organizations, will ensure that responses are inclusive and culturally sensitive. Dear friends, let me turn now to the role of the civil society, which we appreciate its role and what they are doing now. The role of civil society is key. The fight against drug abuse is a challenge that demands a unified response across borders, involving not only governments, but also civil society, you exactly. Civil society organizations play a pivotal role in this cooperative effort. They bring valuable insights into the realities of drug abuse at the community level, advocate for the needs of affected individuals, and contribute to the development of effective prevention and treatment programs. By partnering with governments, civil society can help ensure that policies are inclusive, equitable, and responsive to the diverse needs of populations. Collaboration between governments and civil society also fosters transparency and accountability, encouraging the implementation of evidence-based approaches that prioritize public health and human rights. Dear friends, allow me to turn now to the regional dynamic in the Middle East that might also shape future demand and supply of illicit drugs, especially synthetic drugs across the region. Syria is now witnessing a transition. As the new government is cracking down on drug production and trafficking, the situation remains very challenging. Mindful of the challenges ahead, Jordan hosted on 9th March, this week basically, a meeting on Syria and its neighboring countries that brought together the ministers of foreign affairs, ministers of defense, chiefs of staff, and directors of intelligence services of Iraq, Jordan, Lebanon, Syria, and Turkey. One of the main elements of priority was the agreement of participating states to cooperate in combating the drugs and arms smuggling and organized crime, and to provide Syria with support and assistance in strengthening its capabilities. Jordan welcomes the initiative by the UNODC, who dispatched a team to Damascus to evaluate and assess the needs. Syria needs assistance, and we believe that civil society, again, can also play an important role in the success of policies aiming at addressing the drug problem. In conclusion, it is essential to recognize and enhance cooperation, maximize the benefits of the role played by the civil society in our collective effort to combat drug abuse. By working together, we can build a resilient and coordinated response that promotes well-being and protects the rights of our societies. Thank you.
Thank you, Your Excellency, for your insightful words and for emphasizing Jordan's dedication for fostering international, regional, and international partnership. Indeed, tackling substance use challenges requires shared responsibility and coordinated actions. And now, allow me to ask my friend, my darling Ami, it's your turn for your discussion and importance of drug policies and the role of civil society in a global scale as a president of and the executive director for the Drug Free America, and also the director for the World Federation Against the Drug. Amy, the floor is yours.
Thank you. Thank you so much for having me. And it's an honor to be on this panel with such distinguished guests and all of you in the room. I'm very happy to be here. And I mean, I'm not used to getting to go first, so this is great. So I'll just tell you when to do the slides. So over the next few minutes, I just want to highlight two key initiatives that we have that demonstrate how collaboration can drive meaningful change. We're going to look at our global task force and also our global youth declaration. These efforts both showcase how partnerships across borders, but also across generations, which I think is also important, are essential to our shared mission to prevent substance use, increase access to care, and support recovery settings. Drug abuse is a global challenge that no country can tackle alone. Drug trafficking networks operate across borders, new substances continue to emerge, and prevention challenges are shared by many nations. When countries, organizations, and experts collaborate, we are able to build a more unified, resilient response to drug-related issues. International partnerships enhance policy alignments, share best practices, and strengthen prevention efforts. Next slide, please. One example of a successful international cooperation is our Global Task Force. This is a worldwide coalition of subject matter experts working on prevention, treatment, harm reduction, and recovery. They're dedicated to advancing drug demand reduction and supply strategies. The task force operates through policy development, knowledge sharing, technical assistance, and ensuring that strategies to reduce the impacts of substances are implemented globally. Here is our picture this year from CND. Each year we grow. The task force meets virtually throughout the year, mostly quarterly, but also in person at different regional conferences, not just here at CND. Some of the key activities include empowering NGOs to have a global voice by encouraging their participation in events like CND and contributing to high-level policy discussions with international bodies, conducting educational webinar series to meet regional needs, opening up opportunities to partner on different research projects, and to create resources for use in our advocacy efforts. This kind of cooperation ensures that our efforts are not isolated, but instead contribute to a larger global movement toward prevention and recovery. Next slide, please. Another critical initiative in fostering international cooperation is the Global Youth Declaration. I know Cressida also is going to touch on this. This was created through collaboration with youth and young professionals. I stole their slide. The declaration is a result of analyzing more than 1,100 youth survey responses from 64 countries. The result is a declaration that was launched at a side event yesterday. And I see some of them are here. Our youth from the YMCA McCall is here, and also our youth from Fourth Wave and SOY in India are also here. They are all youth catalysts in moving these efforts forward. The declaration was launched at the side event, and it has 6 different recommendations that include the following: actively listening to involve youth, enhancing research and moderate risk awareness and modernize risk awareness campaigns, to implement gender responsive approaches to address substance use challenges, to ensure increased provision of improved and accessible youth sensitized services, to empower youth through economic independence and leadership opportunities, and to strengthen policy support and policy enforcement. So why is this declaration so important? Because young people are key stakeholders in drug demand reduction. They are the most affected by drug policies, yet they are often left out of the decision-making process. The Global Youth Declaration ensures that youth voices are heard and that their perspectives help shape drug policies at national and international levels. So it's not just about all of our connectivity globally, but also connectivity through that age span as well. Last slide. So the call to action. So as we move forward, there are 3 key action items that I think that we can take together to strengthen international cooperation when it comes to drug prevention. First, we have to expand our international partnerships. The more we collaborate, the more we can share resources, best practices, understand the challenges that we have, and enhance prevention efforts worldwide. Second, we can strengthen youth inclusion in global drug prevention and policy efforts. The next generation must not only be engaged, but actively involved in shaping these discussions and solutions. And finally, I think we have to support the global initiatives that are out there. We have quite a few, like the task force that I highlighted, but there's a lot of other ones through our partnerships and the organizations out there. So getting involved in all these different global initiatives to help grow them and to help share them. That'll support everything that we do. So no country or organization can tackle this issue alone. It's a big issue, and it crosses borders, it crosses demographics, it crosses genders, and so we have to come together to fully combat what's happening and provide the right resources. But through that collective action, we can make prevention efforts stronger, we can help amplify our voice, but also, and more importantly, the youth voices, and create a global network that's dedicated to combating substance use around the globe. So thank you.
Thank you, Rami, for your valuable insights on prevention strategies and policies in different levels, especially in an international. Your work continues to inspire all civil society like us in the Georgian Anti-Drug Society, which share your commitment to evidence-based prevention efforts that we used to promote. Our next speaker now will be my friend Dr. Amr Osman. He is from the Egyptian National Fund for Drug Control. And as you all know, Egypt has made a remarkable progress in drug treatment and rehabilitation. And Dr. Osman will share key insights on the latest policy measures and rehabilitation programs in the region. Also, he will give us the honor to have the possibility to introduce the new campaign the first time here during our event. Dr. Amr, the floor is yours.
Thank you, my colleague, Dr. Musa, and thank you, Your Excellency, Ambassador Hamad Handawi, for this kind invitation in actually a pivotal side event to present the Egyptian experience in combating drugs from human rights perspective. The Egyptian Fund for Drug Control and Treatment of Addiction represents the national mechanism for reducing drug demand through high-quality, evidence-based preventive and treatment services, all of which are fully aligned with human rights principles. The human rights approach is a key component of the Egyptian strategy for combating drugs, which was launched under the auspices of His Excellency President of Egypt in collaboration with all relevant governmental and non-governmental bodies. As a part of this strategy, Egypt has established a network of 34,000 volunteers nationwide, aiming to build their capacities to implement evidence-based prevention programs. This initiative reflects their fundamental right to actively engage in addressing their challenges. Through our youth network, the Egyptian experience goes beyond awareness to prevention by promoting life skills, resilience in schools, universities, youth centers, and youth camps. Moreover, the Egyptian experience is dedicated to protecting the most high-risk groups by implementing an integrated program to reduce drug demand in newly developed residential areas, which serve as alternatives to slums. In this context, Egypt was the first country to launch SHAMS initiative, aimed at protecting children from drugs, violence, and mitigating other risk factors. Today, it's crucial to highlight Egypt's efforts in providing accessible treatment and rehabilitation services based on human rights. To this end, Egypt has established 34 treatment centers in line with international centers in 19 governorates, offering confidential, free of charge services to more than 170,000 patients annually. Furthermore, the Egyptian experience extends beyond treatment to a comprehensive rehabilitation and reintegration methodology that ensures no one is left behind. This approach includes social and psychological support, vocational training, economic empowerment for recovering addicts, and the efforts to combat stigma. In conclusion, I would like to reaffirm Egypt's commitment to supporting regional and international efforts to combat drugs based on human rights approach. I also would like to invite you to watch our new media campaign, which encourages individuals affected by addiction to seek treatment services without fear of any discrimination. ممكن نقص
Have to translate, huh?
It's a translation.
We have
Sometimes.
No, but you know, every room we're having.
Bunu yapsak.
President might know. We had trouble in our office.
So they just leave the computer.
Şöyle yapalım tekrar.
What they use to come up with no, no, it's for those who you don't have people. So you are.
The whole president is
Yeah.
genius.
Yes.
Hocam.
Well done.
Great job. I don't know if you could read the subtitles and you realized how important is such messages to be distributed proudly in Egypt and even in the region. And by the way, I had the opportunity to and the privilege to visit Al Azima, two centers in Egypt, one in Cairo and the other one was in Port Fouad in Boursaid. And I was really very impressed about how professional they are and what kind of service they do and how they really save the lives of those people. And they are hundreds of thousands of ex-addicted people who were, and the positive thing that most of them, they become to help the community in return. So most of the ex-addicted people, they work with those centers to outreach, exactly. I would like to thank you, Dr. Osman, for your insightful, for the evidence-based treatment programs that you offer. You really emphasize us and encourage us to work more together. And by the way, We are on the way to sign an agreement with Egypt Fund very soon between Jordan and Egyptian Fund, which can also facilitate our work, and we might refer some addicted people to Egypt very soon. Thank you so much. Thanks a lot. I'm pleased to introduce Dr. Hussein Nuroglu, board member of the Turkish Green Crescent, our partners as well. The Green Crescent is renewed for its holistic and cultural sensitive approach to addiction prevention and rehabilitation. Dr. Nuroglu, we look forward to hearing from you. The floor is yours.
Okay. Thank you, Doctor. I am Hüseyin Nuroglu from Istanbul, Turkish Green Crescent. Okay, this is the distribution of my presentation. No need to go in details. Next slide, please. Just basics from Green Crescent. It was founded in 1920, more than 105 years old, and we are dealing with 5 different kinds of addictions. Maybe this is the unique organization dealing with 5 different addictions at the same time. We are dealing with tobacco, drug, alcohol, gambling, and screen or technology addictions. And we have, of course, national, international, and in the region, different collaboration initiatives. I will not go into very detail, but we have developed different approaches to addictions. Thanks to our scientific committee, we have long tradition. We have we have experience in this field a lot, and we have user intervention, skill development programs, awareness raising programs at the schools from age like from kindergarten till 80s or longer ages. Just shortly, we have rehabilitation centers. We have 3 of those centers you have in Egypt, and different thing is, I mean, like our Minister of Health also has some rehabilitation centers, but here we do not focus on medical treatment. Okay, we focus on mental, physical, and social rehabilitation. And also we have YEDAM, it is counseling centers. Okay, we have 105 counseling centers, almost in all cities. Everyone who has addictive problems, okay, and kind of addictions, they can go, they can take help without any charge. Okay, it is free of charge. Okay. And also we are taking place in international activities. Okay, no need to go into details. Like we have different in 97 countries. We have Green Crescents worldwide, and we have initiatives and in different countries, organizations, NGOs. Okay, as you know, I mean, the users, the drug users all over the world is increasing. I have the numbers, but I will not go into the details. But maybe in 2022, all over the world, drug usage, the number of using people drugs, 292 million. Okay, it's growing a lot. And also another interesting number here, in 2023, 950 MPS, okay, new physioactive substances are in the literature. And the interesting part is 26 of them identified for the first time in the year 2022. Okay, the number is growing, and in Europe, the market has reached, this is an estimation, 31 billion euros. Why we need cooperation? The answer is simple, because illegal organizations Okay, actually, I don't want to use this term, but the negative term, okay, please, they are innovative, which means they always find new ways, new routes, new methods, and new materials as well to develop that kind of drugs. But that's why you have to organize, because you cannot deal with those illegal organizations alone. Can go on. Okay. And regional crisis, they unfortunately help these organizations to a big extent their activities, like instability in Syria or the war in Ukraine. Okay. As a result of the war in Ukraine and between Russia and Ukraine, they had to change the route of the trafficking. And Taliban, when Taliban comes to Afghanistan, government has banned the dealing with any kind of drugs, such kind of things, and they have impact on drug trafficking. Okay, heroin. As a result of this ban in Afghanistan, the production fell by 95% in Afghanistan, and it's a huge decrease. And also in Syria, tactical trafficking has been affected in this crisis. Okay, and also we learn from the reports that there's an increase in methamphetamine market, and also okay, and as a result of this crisis in Syria, the trafficking moved to the Iraq and Jordan, unfortunately. Moreover, world trade has been done. Okay, 90% of the world trade has been done through shipments, maritime containers, and only 2% of these containers. Okay, we are talking about 500 million of containers, and we are able to check, control only 2% of these containers. Okay, and there's a container control program which was set up in 2004. They are trying to check these containers, and also there's another pardon. Okay, I'm out of time. In Central Asia, there is a collaboration between some countries, and it was set up in 2003. And also in Turkey, we have also some programs. For example, narco field project. The aim of this project was to deal with the drugs on the streets, and also another project, TADOC, which was set up by the assistance of US and some EU countries. Okay, and what kind of activities we have in TADOC, like monitoring educational services and dealing with illicit drug trafficking. Okay. Okay, as a result, as I said, unfortunately, they are very fast, these illegal organizations. They misuse the legal differences among the countries, economic crisis, and political crisis, and they always find new ways, new routes, new methods, and new tools and materials to develop new drugs. Okay, and that's why, and unfortunately, we cannot deal with these organizations alone. We have to cooperate. Thank you very much.
Thank you, Dr. Burago, for your inspiring presentation. And I am witnessing a very importance in Turkish Green Crescents, presenting the International Federation of Green Crescents, which has 100 organizations from 100 countries. And Jordan Anti-Drug Society is proud to be a part of this federation, which can emphasize and strengthen the outcome of working together. So together we are stronger. Thank you so much. And now I know Cressida saved me twice today, and Matai saved me one time because he delayed. And the late will make your presentation will be the last one, followed by signing the MOU, so it will be perfect.
Punishment.
So no, it's not a punishment. It will be more proper for us after your speech to sign the agreement. So now let me introduce to you my favorite speaker, as usual, Cressida Diwat, Program Coordinator in the World Federation Against the Drugs, an organization dedicated to global advocacy and policy engagement in drug control. Cressida, the floor is yours.
Thank you so much for the kind words and creating the high expectations as well. So thank you for that. I'm honored to be part of such an esteemed board today, and I'm here to represent a little bit of the road to impact, as we have already talked a lot about the need for collaboration among NGOs as well as among states, but also between NGOs and states. So kind of have that triangle going on. Next slide, please. So just for those that do not know us, I just want to present our organization, because what is at the heart of our organization is actually international cooperation in order to combat substance use, and as well basically aim for strengthening prevention, increasing access to treatment, and promoting recovery. And we at the moment have over 450 organizational members that are members of ours, as well as over 950 individual members. And we are all committed to promoting and adhering to women's and children's rights, as well as the human rights of the conventions, of course. And our work can be divided into 3 pillars. The first one being capacity building and experience exchange. So this is basically meant for our members to be able to gather, whether this is through regional meetings or regional forums, national forums, world forums, but also to strengthen their capacities in order to work on the local ground through webinars and trainings. We also have development projects, and this also, again, we do in collaboration with our members. It is very important to us that it's always based on a rights-based approach, and that it's implemented on a local level with a local organization. We also do advocacy on regional and international level, and again, this we do for our members, for those who cannot be presented at the international level, but we also do it with members. So like here today, we are actually, some of our members are here, and also in the Global Task Force and in this Istanbul initiative. We're all gathered together in order to collaborate and basically have a wider impact. We also have different committees, so such as the Global Gender Committee, where we focus with some members in our network, basically on women's rights. And we also recently informally launched a youth network, but I'll get to that later. So all our activities aim to stimulate international corporations, to strengthen NGOs in the field, and to enhance our impact. And that international cooperation leads to an impact can be highlighted with some examples. And some examples have already been mentioned, so I'll present a few different ones as well as the same. So next slide, please. So the first one you might have heard of already is the Oviedo Declaration. It's quite a known initiative by now, but we joined the Global Task Force in 2023 when the process started, and we attended a consultation on prevention in Oviedo in Spain. And the task force basically came together and consisted of experts in prevention, and as an outcome of that meeting, a declaration on prevention, the Oviedo Declaration on Prevention, was developed, and it was officially launched during last year's CND. And I personally believe what makes this declaration so incredible and showcases the strength of international collaboration is that it's not only the 10 recommendations that are included, evidence-based recommendations, or not just the global task force that was, at the core of the development of these recommendations, but it's the global coordination that made this initiative so impactful. So throughout the year, over 170 focal points, national focal points, advocated on national level as well as regional level for the Oviedo Declaration. And also national or regional consultations were held where NGOs could join and provide input and present their experiences with prevention and challenges with prevention in their environment. And through this collaboration and coordination today, they have 3,000 supporters already, and it has been also maybe a push for the Chilean government to actually put out a resolution on prevention this year, which is currently being discussed here in this week and hopefully will be adopted by the end of the week. So without the coordinated efforts of the task force, the vocal points and the supporters, the issue might not have been considered as it is now. Next slide, please. The next one is also before. I realized I didn't change the picture. Sorry about that. So there should be a different picture. But the other one is the global position paper on recovery. So this also has a similar core. So it was also again designed by a task force based of experts, researchers, which we also took part of. And they met in September 2023 in Madrid. And they also together established a recommendation position paper on recovery, which foundation is in research. And the paper also got launched during last year's CND, and it has also been supported by a number of organizations, 162 organizations with even more recovery allies. And it also showcases the need to put recovery on the map. And it also is the start of international collaboration on promoting recovery. So this is not the end, it still will continue. Next slide, please. So this is a bit of a repetitive slide, maybe. It is again the Global Youth Declaration on Prevention, Treatment and Recovery. So before I go into that, I want to comment and congratulate Egypt on their youth network. I think it's an incredible initiative that you're doing and also working together with youth, because that was basically the main aim of this declaration. The reason why it came about is because some youth felt that there was a need for them to create a platform in order to voice their opinions. And this is oftentimes, they don't know where to do that. So a core group got selected, or basically got together, consisting of 15 youth from 13 different countries. And they established a survey, because you cannot ask every youth personally, but you do want to include as much youth as possible. And they kind of wanted to showcase the importance of youth representation. So based on this survey, a declaration, as Amy already shared, of 6 recommendations was presented yesterday during yesterday's event. So I definitely recommend you to go through them on the website. That is a link there. But I also again want to highlight the essence of international cooperation here. So yes, it was an international cooperation between the youth, the 15 youth that came together, but it was even more so in the dissemination process of this survey. Without the involvement of organizations around the world, we would not have gathered the over 1,100 responses that we have now in this declaration, because it is often difficult also for us organizations on a global level to reach the youth on a local level. So again, there's this need of collaboration. And now the next step, of course, would be like, also before I go for the next step, one thing which is, I think, very special for this declaration is that we got a lot of data as well. So there's a lot of outcomes of this there's a lot of outcomes that can be and should be considered in our advocacy, promoting evidence-based and youth-sensitized services. So it's quite informative. It's not trying to blame anything, just to suggest. So I think for a next step, it would be the connection between states and organizations. So with that, I want to finalize my presentation. Thank you so much for having me here.
Great speakers and panelists here. They stick on time exactly. So without even an extra minute for each one. So thank you. I really appreciate that. And I would like to thank you, Cressida, for all the efforts of what are you doing in the World Federation Against the Drug and shedding the light on the role of civil society in shaping drug policy worldwide, and for the declarations that you have a very positive input, either in Istanbul initiative, and the declaration has been published from that. I know World Federation was there, and now a video declaration with the Youth Declaration, which made really the World Federation Against the Drug one of the leading networks in this topic. Thank you so much. And finally, We have
Not appointed.
the chair of Vienna NGO committee and the director for UTRIP is here. I know you are busy nowadays, which is the whole week you are busy.
More than I want.
I do understand that. Thank you so much for being here. I really appreciate, even if you are late, but we do understand the situation. Mr. Matai, he's the chair of Vienna NGO committee and the director of UTRIP, a leading organization in Europe known for its evidence-based prevention initiatives. Mr. Koshir, we look forward to your insights on strengthening prevention efforts globally. The floor is yours.
Thank you. First of all, I have to sincerely apologize for being late. We have some serious legal issues regarding the AGM, the General Assembly of Vienna NGOs this afternoon. So we had to discuss as a board about how to proceed and to assure that everything is according to the rules of the Vienna NGOs. So this was, I would say, the urgent issues which was not expected before on our agenda. And I sincerely apologize for being late, but that's why I'm punished. I'm the last speaker. I would like, first of all, I want to say that I'm here as a representative of prevention NGO, not as a Vienna NGOs chair, because I represent something which some of the Vienna NGOs members wouldn't like very much. Sure. I would like to start from the fact that some years ago, some of you might remember that the prevention, treatment, and recovery NGOs have been constantly underrepresented at the UN level in different discussions, not just at the CND, but also in some other fora related to the drug policy. And which I'm extremely proud of, that we as a prevention, treatment, and recovery civil society organizations were able to overcome all our differences and diversity and come together as one voice not long time ago. And we are trying not to change the narrative of drug policy. Of course, many of us would like to do that, but at least to bring the narrative of prevention, treatment, and recovery organizations to the UN level. I would also again like to repeat that not just at the CND, maybe at the CND it's the less problematic. At the CND, we all come, we are all present. We have opportunity to submit written statements, oral statements. We are present at the side events. We organize, co-organize side events. So we have a lot of channels to present our work and to be heard from member states and from UN agencies. But there are some other platforms, some other channels which have been, if I'm allowed to say, in the previous years, pretty much dominated by harm reduction and drug policy reform organizations. That's why I'm speaking today on behalf of UTRIP Institute, not on behalf of Vienna NGOs. So what we are trying to do as a global network of prevention, treatment, and recovery organizations is to bring our voices also to other fora which we are not well represented in the field of human rights, in the field of health in general, World Health Organization, and in the field of UNAIDS. And there are several others areas which are underrepresented by prevention, treatment, and recovery organizations. So I think if we want to strengthen our international presence, we need to discuss on how to strengthen our presence and our influence in that platforms as well. Maybe in the field of related to the WHO, our organizations are well present in the field of tobacco, in the field of alcohol, but in the field of drugs, we face similar issues like in the field of human rights and UNAIDS. And we can clearly see from the reports and from contributions of these UN agencies what is the topic which dominates the discussion in that areas. So we need to improve that and be more present that and more active to strengthen our participation. Also, I would like to say about some regional infrastructures, which are extremely important, sometimes even more than the global infrastructure for civil society organizations. So we are doing a lot to strengthen, to bring our voices also at the level of African Union, African Union's Commission, European Union. There is a civil society forum on drugs. As a consultant expert group of the European Commission, we want to bring more our voices there. There is an Organization of American States and CCAT. They have their own civil society infrastructure, so we want to influence those infrastructures. There are some infrastructures in Asia, in all parts of the world. We have our opportunities to bring our voices and be heard and bring our prevention, treatment, and recovery narrative to these platforms. So, and we know from our own experience, our own activities, that this is possible, that we can achieve a lot. I can just give you one example at the global level. Mr. Ambassador might remember a couple of years ago, the resolution which was filed by Slovenia about early prevention. This resolution was actually initiated by our institute in Slovenia, and thanks to the open-minded government and the Ministry of Health, they accepted the challenge, and the mission accepted the challenge and brought this challenge to life. And now we can obviously see what are the outcomes. The CHAMPS initiative is an outcome of this resolution. The new discussions, I don't know, Oviedo Declaration might be as well mobilized, motivated by this early prevention resolution. And now Chilean resolution as a continuity of this momentum for prevention. And now we have a global paper on recovery. We will try to do pretty much the same efforts and activities, similar activities to bring recovery higher on the political agenda. So you see that a lot is possible if we are proactive, if we are connected to each other, not like 10 years ago, the therapeutic communities on one side, the recovered users on the other side, prevention somewhere hidden in the hallways of the UN. If we come here as a one voice, we can do a magic. We can do a lot. And we have a lot of things already implemented and a lot of outcomes out of this our initiative. So I hope I was short enough.
Thank you. Thank you so much, Matthias Huge-Welder. We would like to appreciate your efforts in UTRIP, and I really was following all your efforts with the Slovenian government, and you have made a very positive movement for doing, for making the civil society role more effective in the field of prevention. Thank you so much. I would like to thank all of you, and I would like to invite you all to witness signing the MOU with UTRIP between the Jordan Anti-Drug Society and UTRIP for a couple of minutes.
So,
I move process so that the signing makes sense. Please.
بالعكس وجودك يعني شرف لنا. أعطونا Thank you.
I was wondering what the stamps for until now.
You now realize.
And I read it in advance, so don't worry, I know what I'm saying.
For sure. Thank you so much.
Okay.
Absolutely.
Thank you so much. Thank you. Thanks a lot. This agreement will encourage us to work more forward in evidence-based programs that I know how you do it. They are expert and professional in training and capacity building programs. So we hope that we're gonna get the benefits from this agreement in the very near future. Thank you so much. Thanks a lot for all of you being Please.
Yeah, maybe also something for me. We promise that this will not only be the Jordan and Slovenia collaboration, but these efforts will be integrated in our global work. For absolutely.
It's for me, you know, as ambassador of Jordan to you and the representative to the CND, I think this side event was very educational for me. I learned a lot. And most importantly, I guess, what I stressed in my statement, the role of the civil society as generator of ideas, and we will be following up on any of the ideas that has already been reflected during this side event. And we're looking forward for our future cooperation.
Thank you so much. We really appreciate the support of our government represented by your excellency. Thanks a lot.
Okay, and a little gift from me, my first book, in the field of prevention. It took me 10 years to finish it.
We need a follow-up on this.
And it's 30 years of my frustrations in the field of prevention and one small piece of paper. So, and it's also,
So that we continue our
so if I need visas for Jordan,